Ear infections and the chiropractic approach. My wife and I have been in private practice specializing in helping children and their families for well over a decade. And of all the issues that happen with our pediatric patients, ear infection is probably the most common. This is commonly the condition that starts children down the antibiotic superhighway, of which it seems there's just no return. No parent forgets the trip to the doctor after having their child, especially their first, wake up in the middle of the night screaming and clawing at the side of their head while they're sweating profusely with the fever. Not a pretty picture. But are antibiotics and medical intervention the only option when it comes to childhood ear infections? The easy, quick answer is no. I want to start off by clarifying that not all ear infections are actually infected ears, or even infections. Children's eustachian tubes, or the ear canals, are not slanted down like those of adults. Their canals are straight across or horizontal, making it hard for your baby to get much help from gravity to move the fluid from the lymph nodes in the ears into the throat and out of their body. So the problem comes when the fluid and congestion build up in the lymph nodes and the sides of the neck and the throat, and it cannot be moved or flushed out of the child's body. And that fluid has to go somewhere. So if the fluid can't go back down, then it will frequently back up into the child's eustachian tube, causing fluid pressure in the back of the eardrum. And this pressure will cause swelling and irritation, pain, just like an infection. And if left unaddressed long enough, can progress into an infection. The problem, though, is that most pediatricians are medicating the kids they see before they know whether or not they actually have an infection. Many of us have gone through this in the past. We've taken our child to the pediatrician because they are obviously in pain and they're acting funny or pulling at their ears, and the doc kind of looks in their ears with an otoscope, something like this, and looks and he says, "Hey, little Johnny's got an ear infection, and I'll write you a script for an antibiotic." Now, just think about that for a moment, because how did the doctor know, just from the color of the tympanic membrane, the eardrum, how do they know that your child has an infection? He didn't. The only way to truly diagnose an infection in the ear is by doing a swab of the ear and culturing the area. Then they can see for sure whether or not your child actually has an infection. So if they don't do that, the problem more than likely, is fluid buildup behind the eardrum, or the area may simply be irritated, red, swollen, painful, due to teething, because the ears are close to the gums and the mouth, and often react when this area is under stress. Now, of course, if your child is running a raging fever and the side of his or her face and head are on fire and the ear is oozing a colorful pus, then yes, you could definitely say he or she has an infection. But for the majority of children going into the pediatrician's office for discomfort, sleep issues, or whatever the parent noticed lately, the problem isn't necessarily an infection. The reason for prescribing antibiotics without a true infection diagnosis is that if your child is having an underlying infection, the drug will take effect. But the less you have to medicate your child, the better. And if there's not an actual infection, there are other options. So what do you do if your child is fussy and having issues with one or both of their ears? Are there things you can do besides medication to help him or her feel better and help the fluid move out of the eustachian tube? Absolutely. The American Academy of Pediatrics recommends that the best approach for an ear infection is to what they say, watch and wait. They don't even recommend routine antibiotics for this condition, and say that most heal at the same rate whether you take medications or simply wait and do nothing. I would just like to add to that, why wait and watch and do nothing when you can have your child adjusted by a pediatric chiropractor? More on the chiropractic approach in a moment, but for now, this is what you need to know about natural therapies. Yes, there are some amazing natural ways you can do at home with a bit of lifestyle changes to help ear infections. Some of this is simple, but most of that is not, especially when you start getting into major dietary changes and popping pills. Now, if there was a cheat sheet you can do that is so simple, you don't have to do anything but show up. It doesn't involve popping a pill, no medication, no drugs, not even remembering to take supplements. It's 100% natural, safe, and effective, and was used as a treatment by ancient Orientals 7,000 years BC in the Ming Dynasty. Most of all, it still works today, and is considered part of primary health care with the right type of doctor. And best of all, no toxic chemical side effects. Are you interested? Of course you are. Who wouldn't be? Now, this is not to say that making major lifestyle changes isn't recommended, because they are. I just want you to know there's a quick, safe, simple way you can do first, and then complement it with the other natural therapies after. Here's what you need to do. First of all, middle ear infection, or otitis media, is one of the most common childhood afflictions. In fact, it's impacting up to 2/3 of children at least once before the age of 3, and up to 90% before the age of 10. Now, ear infections are the #1 reason a child visits the emergency room and a pediatrician. The most common treatments for ear infections are antibiotics, and if that doesn't work, ear tubes. Your pediatrician likely has the best intentions when they prescribe your child antibiotics or recommends ear ventilation tubes. But there are 3 major flaws with these recommendations. A simple PubMed or CDC search yields all the information you need to determine ear infection management. And I'll tell you, it's not as black and white as you have been led to believe. There are 3 things your pediatrician likely did not tell you when recommendations were made in managing your child's ear infection. Let me cover those. First of all, most ear infections are viral, which means using an antibiotic that kills only bacteria doesn't work with a virus. The CDC's website antibiotic recommendation page is very clear. It shows that the research that the usual cause is a virus and antibiotics are not needed. 2, the antibiotics in the ear tubes can be dangerous. The literature is clear. Antibiotics in children are linked to asthma, obesity, overall lowered immune function, and even adult disease. See, ear tubes do not improve long-term hearing, cognition, or academic outcomes. They show that the ear tubes lead to scarring and have been linked to poor hearing 6 to 10 times years later. Antibiotics do not treat the cause of ear infection, which is poor drainage. So using antibiotics or even tubes are merely a band-aid approach. Ear infections are caused by the Eustachian tube not allowing fluid to properly drain from the middle ear. When the fluid becomes stagnant, it becomes a hotbed for viruses and bacteria. Again, killing the bugs is not a long-term solution. And if you're looking for a safe, long-term solution that addresses the cause of ear infections, believe it or not, pediatric chiropractic is the answer. How does that work for you? There are 4 muscles that are closely associated with the Eustachian tube, and these muscles help open and close the tube. When these muscles spasm and lose their normal tone, their function is lost, and the ability to open and close the tube is compromised. What would cause these muscles to spasm and lose function? Improper nerve input. This is caused from upper cervical neck misalignments or subluxation. So the chiropractic adjustment restores normal motion and alignment to the spine, which in turn restores normal nerve function and normal muscle function. And in this case of ear infection, it would be muscle function to the Eustachian tubes. This ultimately allows the tube to drain appropriately. Lymph nodes need proper functioning muscles to contract with your baby's head movements in order to flush out the fluid and the congestion pools in that area. So when the bones in the top of your baby's neck become, restricted due to birth or any other type of physical stressors, even crawling, breastfeeding, weird sleeping positions, right? Mom knows those. These muscles around that area, they don't contract properly and they don't work correctly. And so if the muscles don't contract perfectly, then the body has a hard time flushing out the fluid in the ear canal. Gentle adjustments to this area helps to reduce spasm and reestablish normal motion to a restricted area, which offers tremendous relief when your child has too much fluid in his or her ears. Adjustments also boost the immune system and helps the body to function optimally. These gentle adjustments use about the same amount of pressure it takes to test the ripeness of a tomato. Pediatric chiropractors are specially trained, and because we do so many of these adjustments, we become sensory attuned to know where and how and exactly what needs to be adjusted, thanks to our exam of the infant or the child, and something we call palpation, when we actually touch and palpate the child's back and neck. In short, we may be able to learn how to read Braille, but unless you are blind and totally rely upon Braille for communication, you simply never develop the sensory acuity and talent it takes to read Braille like a pro. So it's the technique and it's the art of the skill you only develop from doing it every day. Again, nearly half of our office is dedicated to children, including newborns. And we've been doing this, my wife and I, for over a decade. It's very gentle and very effective and very safe. And best of all, unlike most natural treatments that require popping a pill or remembering to apply an oil or completely transforming your diet, all you need to do is show up and get an adjustment so the body can begin to heal naturally. And of course, the other natural therapies can help speed up the healing, and for some are needed to complete that process. But we find in our office, having the kiddo adjusted around 3 to 4 times usually helps to drain the tubes and clears up the issue. I'm Dr. Matt Hammett, reminding you that it's always a great idea to have your kiddos checked by a family-based chiropractor. I hope you enjoyed this video and others like it, so you can be more engaged in your spinal hygiene for your family and friends. And as always, we invite you to become patients in our practice, and if you already are, kudos to you and your family. Help us spread our message by becoming fans of our Facebook page and sharing these inspiring videos with your loved ones. May God bless you.